So, what are the main reasons of medical conditions for considering ovary tissue freezing instead of or in addition to egg freezing? Well, that's a great question. So, if you're a cancer patient, most clinics, unfortunately, will only do egg freezing. And that makes no sense because they're delaying your cancer treatment. And then you only have one cohort of eggs, and that's it. And so you're just depending on that one cohort of frozen eggs. With ovary tissue freezing, we're getting 200,000 eggs. And furthermore, with ovary tissue freezing, we can implant the ovary tissue back. It's not a big operation to transplant it back after your cancer is cured. And you'll be ovulating and menstruating normally and have normal hormonal function. So for cancer patients, freezing eggs you have to be on hormones the rest of your life. You're menopausal, and with ovary tissue freezing, you're just normal. That ovary tissue is transplanted back. You get pregnant naturally. You don't need IVF. You just get pregnant normally with intercourse. So I think ovary tissue freezing is much, much better for cancer patients.